For me, OMIDRIA has simplified my procedure for cataract surgery in a number of ways. First of all, as a glaucoma specialist, I tend to see a lot of patients with pseudoexfoliation, people who have, let's say, narrow angles, shallow anterior chambers, people on Flomax, complicated cataracts, and you want to decrease any variable as much as possible, as well as pain and inflammation, not only intraoperatively, but also postoperatively. So one thing I can tell you clearly is we've decreased the need for iris or pupil expansion devices, hooks and rings, etc. Because what happens with OMIDRIA, with having phenylephrine and ketorolac, at the time of the procedure, with a constant irrigation, you're able to keep that pupil more stable. But by keeping it stable, you decrease a lot of the variability, especially with those chambers flattening or that iris coming into the tip of the nucleus or the phaco needle. Number two, I think when you have shallow chambers, you really want to help protect the iris from prolapsing out of the wound. That is a no-no. When that iris comes out of that wound, it's a torture to have to give it back in the eye. So for me, those are the simple things that have helped me a great deal in my cataract surgery. For me, I do think OMIDRIA has helped not only simplify the surgery, but also simplified my post-operative drop regimen. I think having intraoperative anti-inflammation, anti-inflammatory mediators, it does help decrease that cascade, that initial push of inflammation during surgery. And so by helping minimize that kind of leaking of a blood-aqueous barrier during surgery, post-operatively, patients tend to have less inflammation, at least from my hands. What that does, it decreases the need for topical steroids, either eliminating them sometimes or decreasing the dosing regimen to maybe say BID for, let's say, a week or two and stopping it. Number two, I think also patients who have a lot of inflammation and pain after surgery, we're not having to add more drops to help calm the inflammation. And surface issues, when you start adding topical drops, right, with preservatives, etc., the surface of the eye gets irritated. And we can actually limit the number of drops, limit the preservative, and the patients aren't having to use artificial tears quite as often as well. So the speed to recover in terms of visual acuity has also been improved. So for me, the simplification intraoperatively, but also translates to the post-op period as well. For me, the biggest advantage for using OMIDRIA is not stressing out. I can't overemphasize how important it is for us to limit variability and to control our environment, to not stress out. When you have OMIDRIA on board, it doesn't make the surgery always easy, but it does decrease the variability. And I think having that pupil and that iris as stable as possible, helping calm the inflammation post-operatively, that combination helps, again, keep more of a stable, consistent surgery and post-operative period. At the end of the day, it's about patient happiness, patient satisfaction. And I can tell you clearly that my patients are happy with the use and help of OMIDRIA.